Well, welcome to HIMSS 2026. It's Thursday, March 12th, and you're watching Oracle TV. I'm Shanna Adamic, your Oracle TV anchor, and I'm here at the Oracle Health and Life Sciences booth located at the heart of the HIMSS showroom floor. And one thing is absolutely undeniable, and that's AI is changing everything. You can feel it in the conversations. You can see it in the demos. It's all about accelerating discovery. It's about reducing administrative burden. It's about giving back time to our clinicians. It's about re-architecting how care is delivered and how research becomes real-life impact. Here at Oracle Health and Life Sciences, one thing is in focus for us, and it's simple. And maybe not that simple, but it's AI is embedded. It's built into the work stream, to the infrastructure, to the applications themselves. It's in our new Oracle EHR. It's in our clinical AI agent. It's in our AI data platform, both for health and life sciences. All AI enabled at the core. And today, we're going to have amazing conversations. We have an incredible lineup of industry experts and Oracle Health and Life Sciences executives, and they're all going to talk about one thing: what this moment means, where we are in healthcare, and where we're going. We're about ready to get started with that, but we are going to take a quick break, and when we come back, we're going to jump right in.
The future of healthcare is no longer just a vision. It's here. While others are still planning for this future, Oracle is delivering it and putting AI in action. We've moved beyond hypotheticals into a world where intelligent systems are a reality, where AI is pervasive and unified data drives smarter, faster decisions at every level, where clinicians are reconnected to what matters most and care is proactive, predictive, and personal. This is a world where Oracle takes all the lessons learned from nearly 50 years of working with the most successful businesses to totally and completely transform healthcare. We've built the industry's first unified enterprise AI platform, connecting electronic health records, financials, workforce, supply chain, and all your data under one intelligent architecture. AI is not just bolted on, it's built in across every part of the system, already advancing clinical assistance and matching patients with clinical trials, simplifying billing, reducing friction between payers and providers, and accelerating predictive value-based care. It gives patients greater insight into their own health and gives doctors more time to focus on them. It's delivering real-time insights and making every touchpoint smarter, every decision more accurate, and every outcome better, from breakthrough discovery to bedside delivery. And at the core, Oracle's AI agents, plus the power to build your own. This is transformation at scale. This is the intelligent continuum of care. This is how healthcare becomes what we've always hoped for. This is AI in action.
Well, welcome back to Oracle TV. We are going to kick this off with our first guest, and I am sitting here with Chris Vernaci, who is the Associate Vice President of Technology Ventures at Universal Health Services. That is a long title, but a good one.
Yes. Yeah, it's a long title. There's a lot of work to do. So I guess the title sort of fitting from that perspective.
It matches the work, and I appreciate that. And, Chris, it's great to be sitting here with you and talking with you about the work that you're leading, because we know each other and we've been at this for a while. So let's just start there. Talk to me about the work that you're leading with UHS.
Yeah. Serendipitously, I think the work that I'm personally doing at UHS is just so much of an extension of the work that you and I have been doing for a long time now.
Yeah.
I met UHS through some of the work that you and I did years ago. And so that was my introduction point. And to me, it's kind of just like the last mile. It's sort of completing this digitization of health records, driving clinical improvements. And, at the end of the day, like going from carrying your bag of medical records from doctor to doctor, like we're still solving some of those problems. And now I'm on the provider side doing that. The skill set and the problems are not much different. So it's just a different perspective, maybe.
And isn't that interesting? We're in this fast forward motion moment, but we're still dealing with some of those problems
yes.
of carrying the bags and the papers
yes.
and all of those from appointment to appointment.
That's right. Yeah. And, what I appreciate being on the provider side, especially one like UHS, is just the scale.
Yeah.
So we have 29 acute care hospitals around the country, 346 behavioral health locations between inpatient hospitals as well as outpatient therapy. So when we are trying to solve a problem, like the scale that we're trying to solve the problem is massive.
Yeah.
And, so now being on this side of the table, that's where I probably have more appreciation for big problems, not a lot of resources to go solve big problems in healthcare.
Talk to me a little bit about those problems. What are some of those challenges that you see?
Yeah. I mean, nothing unique and novel. It's in the sense that there is so much administrative burden in healthcare. And I think that we thought in the industry that we were going to digitize medical data, and that in of itself would relieve the administrative burden. And
Right.
it just didn't.
It became a diary.
Yes. And, and so that's where we have been focused now with, advancements in healthcare technology, leveraging artificial intelligence when the time is right to really go tackle all those administrative burden areas where it's labor intensive, complicated. Usually for us, it's just work that couldn't get done. And so now we are able to get more work done, quite frankly.
And that's really, you looked at those challenges and you thought this is where we need to modernize that patient and clinician experience.
Yes.
And, going on from that, how is the clinical AI agent improving the patient and workforce experience?
Yeah. Yeah. So, where we are leveraging AI around administrative burden areas, I would say we first started last year and spent most of our time in the back office billing, coding, collections, because that's where there's a ton of process that just doesn't get done. This year, our focus has been more on clinical operations. So we work through methodically in our business offices, what are our big bottlenecks? And let's leverage tech and AI to address those bottlenecks. Now we're taking that same way of working and saying, okay, in our clinical operations, what are the bottlenecks? And leveraging tech to alleviate those bottlenecks. CAA, some would argue like you've had physician documentation now for 20 years in the industry. And you've had voice dictation. If you just go compare the output of a traditional physician note, even using voice dictation software, to the output of an AI assisted note that something like CAA creates, just right away, you see a very big visual difference. The amount of detail that is in that note. And yes, it frees up physician time, but I think more importantly, the detail in that note becomes the patient's story all along their care journey.
And that's important, to be able to see this like a story. And that leads to the desired outcomes. That leads to what happens next in your journey.
And so I think frequently the value of an ambient scribe, it always gets talked about in terms of clinician burnout. Yes, I understand that.
And I know it's almost like we don't even want to say burnout anymore, but we have to because it's real still.
It's very real.
Still being addressed. Yeah.
I would say I have business burnout. I want to use an ambient scribe in all of my meetings too. So I totally get that. But I think the most valuable part of these tools are what happens next after the note is generated. And a more complete note, again, it's that story that follows the patient. When they get discharged from our hospital, that story goes with them to their post-acute care. When our clinicians are trying to discharge a patient, having a more accurate story helps us get them out of the hospital faster.
Yes.
And then from a direct business benefit, it helps us with billing, coding, and collections.
Yeah.
It helps us not miss important documentation that our business office teams also rely on.
Every single layer.
Yeah.
It's impacting every single layer. Are you hearing feedback that this is having a positive impact, or what are you hearing?
Yeah. Lot of great feedback. We've got a lot of experience, I'd say coming up on 12 months that we have been using CAA in our physician practices. And our physician practices are all specialties.
Congratulations, coming up on 12 months.
Yeah, thank you. Our physician practices are all the specialties, primary care, cardiology, you name it. And I think what's impressive, we always say users vote with their feet. And this has been one of those deployments where without a lot of change management, that the users are adopting it. Sometimes on 100% of their notes, which is very rare. And you and I both know there are some specialties that are ahead of the curve or behind the curve. And some of the ones that are usually behind the curve are using it on 100% of their notes. So
that's interesting.
So we're meeting the objective of saving physicians time. I think we are helping the burnout. Again, what I think is more interesting is how we see that continue to play out and all the other downstream impacts and patient care, quality, and experience.
Well, Chris, as we talked about at the beginning, we've been at this for several years now, and we have felt that, that from the digitization of healthcare to the hype in AI, and now we're seeing this be put into practice. I hear people call this the great healthcare reset. Some people say it's the AI healthcare era. That's what it was. What do you call it? What do you think this is? And what helps you be the most optimistic about where we're going?
Yeah, I refer to it as the so what era.
The so what era?
The so what era.
Tell me more.
Yeah. And I did not coin that phrase. There are some folks that I have worked with over the years.
No, you take credit for that.
Yeah,
it happened
so
right
I'll
here on
take credit
OTV.
for it now. For years we digitized the record, and then algorithms and machine learning came along, and so we took that data and we summarize, here are all the patients that have a gap in care and their chronic condition, and there is a next step in their journey that needs to be taken, and somebody needs to intervene, and we called that population health. We're going to drive down the cost of care because we're just going to make the community more healthy. What I didn't have an appreciation for when I was on the tech side, that I have more of an appreciation for now working on the provider side, is that there's still a capacity problem in healthcare. And so surfacing analytics and insights, great, but who is going to pick up the phone and call that patient to get them to the next step in their care journey?
Right.
And so now, leveraging AI, we can start to augment our staff that did not have time to get to these very important follow-up discussions with patients. And so, for us, we can now 10x the output of a nurse because we can augment the things that a nurse doesn't really need to spend time on anymore, and only push the things to a nurse that requires a nurse intervention. And so that's what I mean when I say
That's a big deal. And that's a big deal.
We've digitized the record. We've done the analytics. We've identified all the registries and gaps in care. Now we can orchestrate care leveraging AI to really go do the work that no one had capacity to do. So I think AI starts to solve not just like the cost, and the efficiency problems, but it's a capacity problem in healthcare.
Yeah. It's a capacity problem, and it's proving it.
Yes.
It's showing up in that space. I like that. So the so what era, I'm going to add that to my list. But I think that it's great to see, in this moment, we're at HIMSS, the excitement on the floor, that we are beyond that hype, that we're in this, whether it's the AI healthcare era or the so what era, but we're here, and it's going to move and fast forward. Chris, it's always a joy to sit down and talk with you. It's been a pleasure to work with you over the years. And I know that we're proud as Oracle Health to continue to work with you and helping to transform healthcare.
Yeah, feeling is mutual. Thanks for having me.
Oh, thank you. And we'll be back right after this.
We've lived through the last couple of decades with the growing frustrations of the electronic health record not delivering on its original promise, which has been to make us more efficient and help us be better doctors. Oracle Health's clinical AI agent is an ambient listening application that allows the provider to have a conversation with the patient. Using this AI assistant has really helped with our ability to connect with the patient.
Well, thanks for coming back to Oracle TV here at HIMSS in Las Vegas. And my next guest, I'm a big fan of, Dr. William Paiva, who's the Executive Director of the Center for Health Systems Innovation at Oklahoma State University. I should have worn my orange for you.
I know, it would have been great. And I should have worn like a orange handkerchief or something.
Yes.
We didn't do as good a job as we should have to coordinate.
We didn't, but I do
But
think
we do have a yellow hanky to match your
Absolutely.
outfit, so I did the best I could.
I
So
love it. I
here
love
we
it
are.
so much. And thank you for being here.
Of course.
It's
my
honestly
pleasure.
always a joy to talk to you. I just smile when you come around.
Aw,
So
thank
just
you.
know that we're a big fan of yours here.
Thank you.
Okay.
And me of Oracle. For sure.
Aw.
We'll get into that.
Yeah,
So, for sure.
absolutely. Well, let's talk about that because, I think it's so unique that your center sits at the intersection of business and clinical innovation with a bold mission to transform rural and Native American health.
Yeah.
So let's start there. Can you tell us a little bit more about the communities you serve?
Of course. And to do that, I need to provide a little bit of context because I think it sets the stage.
Absolutely.
So prior to launching the center at Oklahoma State University, which is about 12 years ago, I was a venture capitalist and still operate a venture capital fund. So for 26 years now, I started in 2000. So for 26 years now, I've been running a venture capital fund, investing in some of the leading, most innovative companies in drugs, devices, diagnostics, technology-enabled services. So it's innovation and health innovation's been in my fiber for a long time. And so I came at this job from the context of a venture capitalist and an investor in startup healthcare companies. And for 26 years, I've seen almost all innovators focus on urban healthcare, right? Well, why do they focus on urban healthcare? It's where the people and money are, right? Why does Willie Sutton rob banks? Well, Willie Sutton robs banks because that's where the money is, right? That's where the innovators focus on is urban healthcare. And unfortunately, rural markets, in our case, rural and Native American, because those Venn diagrams overlap quite a bit, unfortunately, the rural markets get overlooked. We love talking health disparities. The number one health disparity, I would make the argument, is rural healthcare. 20% of America, 66 million Americans
I tend to
live
agree
in
with you on that,
rural markets dealing with inadequate healthcare. So as a venture capitalist, I looked at it as an untapped market, right? That's what I was like, okay, that's a $66 million person market that's untapped. So let's go after that. And it also supports our land grant mission at Oklahoma State University. Oklahoma State is a land grant university designed to service all things rural. Oklahoma is a rural state. So for all of those reasons, it pointed us to go after rural and Native American markets.
Wow. Thank you for the insight there. I mean, you've worn many hats.
Yes.
And I think it's so interesting how you've crossed over with those hats and took that into what you're doing and how you're working to transform healthcare.
Yeah.
And so when you look at this whole ecosystem that you just described and the community that you serve, what are some of the biggest challenges and opportunities that you see?
Yeah, great question. And, when I started the center 12 years ago, rural was an untapped market. Roll forward 12 years later, rural's the new hot market, right? Like it's amazing how rural's become a very important topic in our discussion on health innovation. And even the Rural Health Transformation Program that came from CMS that's funding into the states and being distributed within the states, the name is Rural Health
Which we need to talk
Transformation
more
Program.
about at some point.
Of course, we can. And our mission at our statement, or our vision at our center is to transform rural and Native American health. So I'm like, our vision 12 years ago is aligned with our HCP. But anyway, so back to your question. When we started the center, one of the things I was really insistent on with my team is, where are the opportunities, right? Because you can't boil the ocean. You can't do everything.
No, you can't.
And I knew as a venture capitalist, one of my favorite sayings as a venture capitalist was, entrepreneurs have a great ability to discover solutions for problems that don't exist, right? So I'm like, we're not going to go after problems that don't exist. We're actually going to go find the problems. So one of our very first things we did is we interviewed over 250 rural providers throughout the state of Oklahoma, physicians, office managers, nurses, and said, what are your major challenges for delivering care in rural markets, right? That then became the foundation to align all of our innovation effort behind some of those major areas. I'll highlight a couple of them for you, right? So two of the biggest ones is the lack of primary care, right? So there's a shortage of primary care in rural markets, number one. Number two is the lack of specialists. I call it the lack of ologist. There are no cardiologists, neurologists, oncologists, nephrologists. Pick your favorite ologist. They're just not there, right?
Lack of ologists.
Yeah, I call it, and we're actually written an article about it called The Lack of Ologist in rural America. So lack of primary care, lack of specialists, or using my vernacular, the lack of ologist. To give you a stat, for instance, in the state of Oklahoma, we have roughly 800 doctors, primary care doctors, in rural. So roughly about 800 rural primary care docs. If you do the math and said, how many primary care doctors would we need in rural Oklahoma just get us to the average number of doctors per rural citizen? We would need roughly 2,000 rural primary care docs to just get us to average, not even exceptional. We're currently at 800, so we have to get from 800 to 1,200.
Yeah.
We can't graduate enough doctors to put them into rural Oklahoma and solve that problem. It's not saying we shouldn't do that. We should continue to do that. But what we actually need to do is bring to market technology layers so that we can actually deliver healthcare with technology layers, and then solve that second problem, which is the lack of specialists. And how do we actually use technology layers to bring specialty care into rural markets without worrying about bringing humans? And that's where Oracle comes in.
Yes. Okay. I was like, that's where it is. That's where the magic happens, and talking about that and bringing that technology in to layer in, and then bringing in those specialists. So let's talk specifically about data in the Oracle EHR Real-World Data. Now, this is a de-identified data set representing more than 129 million patients across the U.S. So why was access to data at that scale critical for building meaningful clinical tools? Talk to me a little bit more about that.
So we were blessed to receive that data early on. And so I describe it as we were doing predictive analytics before predictive analytics was cool. So we started 12 years ago.
Yeah.
We did it so far back that we called it just basic analytics, and then became predictive analytics, and then prescriptive analytics, and then machine learning. And now we call it AI, but we've been running the whole journey of it, right? What's really unique and nice about this data set is, unlike other data sets where you can find claims data sets like the Medicare claims data sets, or you can get Medicaid claims data sets, all of that really does is show access, that people are actually, going into the health system and accessing, and somebody paid a claim, right? The beauty of the data that we have through Oracle is it's all back-end clinical data, right? And you mentioned it was de-identified and HIPAA compliant, right? Which for me at a university means I can jump right into doing a data analytics project without having to go through IRB. It's IRB exempt. So I don't have to go in and get formal approvals to run the trial. I can actually literally, you and I could come up with a data project, and tomorrow we could start working on it because it's de-identified, HIPAA compliant. Whereas in the old days, if it were identified, not in the old days, but if it were identified data and not HIPAA compliant, we'd have to go through a whole institutional review board process, which could take as long as 6 to 9 to 12 months just to get approval to start the project, right? So because it's de-identified and HIPAA compliant, we actually can jump into the data immediately. It's clinical data, so we actually have relevant information about the patient. And the last thing is, and you didn't mention this, but it's one of the more important things, is the data set is longitudinal. So even though it's de-identified, it's longitudinal because every patient gets a unique patient identifier. And so that patient 11689457, whatever it is, that's William, right? And every time that unique identifier shows up in a health system that's running the EMR from Oracle, then it captures that data. So it's longitudinal, even though it's de-identified, which is so critical to do predictive analytics. If I just have a narrow snapshot of data, then I can't do anything with it. I need the longitudinal. Can I give you a quick case study?
You absolutely. I was actually going to ask you.
Is that the next question?
Absolutely can.
So to make it real, I'll give you a very specific example of a project we did. One of the biggest challenges in rural and Native American markets is diabetes. It affects the rural markets at much higher rates than the urban markets, right? If you're a diabetic, you're supposed to get an annual retinal eye exam for diabetic retinopathy, okay? And that's blindness from diabetes. The number one cause of blindness is diabetic retinopathy. The way diabetic retinopathy mostly gets diagnosed is the diabetic presents to his primary care doc. They say, "How you doing?" He said, "I'm doing fine, except for I don't see as well as I used to." And then they're like, "Well, remember I've been telling you for 5 years to go get your eyes examined to see if you have diabetic retinopathy," and they haven't gone because there is no ophthalmologist in rural. Remember my lack of ologists?
Yes.
So they got to drive to an urban setting to get the evaluation, and they're not going to do it. That's why they don't do it. So we took that data and we said, can we actually, just based off of the clinical data collected in a normal primary care encounter, can we develop a tool that will identify which of those patients are at highest risk for diabetic retinopathy? Right now, we're just looking for risk stratification, eventually it'll become a diagnostic, right? So we have a tool right now that will pull data out of their demographic information, their comorbidity information, and their laboratory data from basic lab data like a CBC and a lipid panel. It's a 14 variable model.
Okay.
And we can now predict with an AUC or whatever metric you want over, the current AUC is 80, 0.89. Sensitivity and specificity is over 90%. Now I can give a tool to a primary care doctor, because right now what they tell them is go get your annual retinal eye exam in case you have diabetic retinopathy.
Yeah.
Now I can actually say, based off your data, you're at high risk for diabetic retinopathy. And oh, by the way, if you don't do anything about it, you're probably going to have vision loss next year. That's a motivated patient who will now go get the ophthalmic care that they need in an urban setting.
That's incredible. And so is it fair to say that with Oracle Health that you all are doing things that weren't possible at one time?
100%. Because I get very, can I tell you one more quick story about the
One
data
more
set?
quick story.
Because I know we're on time.
Yes.
You asked for the interview, not me.
Okay, that's fair. But one more quick story. I do want to hear this.
So and it shows you the power of the data. So we originally built this tool. We went after 5 known variables. Okay. So things like, are you comorbid for other diabetic complications like diabetic nephropathy, diabetic, neuropathy? Was your A1C levels high? Was your blood sugar high? We built a 5 variable model based off of those. And we said, is this predictive or stratifying the risk of a diabetic patient that has diabetic retinopathy? Turns out it was about 60% sensitive specific. So not very good. It was kind of a coin toss. Then we went into the lab data. Once again, it's clinical data. It's not encounter data, claims data. We dumped all of that lab data for all those patients that we pulled out of the data set, and we identified 9 additional variables that were highly correlated with the onset of diabetic retinopathy. We would call that artificial intelligence now. We were actually just calling it advanced machine learning at the time. We picked up 9 variables. When I added it back to the 9 lab variables, now I have a 14 variable model that gets me to the 90% sensitivity and specificity. That's the power of the data that you could not have been able to do if it weren't for the breadth and depth and longitudinal of that particular data set.
I love that. That is the power of the data.
Yep.
Thank you so much. It's always a joy to sit by you, and I love your passion. We need more people like you in this transformation of healthcare. Thank you so much for joining us, and join us back here for more conversations at Oracle TV.
Most health systems started adopting electronic health records back in the 1990s to replace paper-based processes. Although EHRs were supposed to help clinicians, they ended up creating more complexity, administrative work, and IT overhead. This forced clinicians to become data entry clerks, documenting their own work and navigating insurance companies, and took precious time away from patient care. Not to mention, it contributed to skyrocketing healthcare costs. At Oracle Health, we believe technology should work for clinicians, not the other way around. That's why AI must be foundational. The Oracle Health EHR is much more than an incrementally improved electronic record storage system. It's the next generation of EHR, built to continually take advantage of rapid advances in cloud technology, AI, and data sciences, while simultaneously removing the friction and fatigue caused by outdated systems. It's like having an intelligent clinical assistant personalized to your clinician's needs. AI is seamlessly woven into every layer of the Oracle Health EHR to deliver near real-time clinical insights and contextual decision support tools directly at the point of care. For example, clinicians can plan and manage their day with easy-to-digest patient summaries that help accelerate chart review. They can also use voice-driven navigation as part of their day-to-day care activities to quickly access critical information, such as recent vitals, medications, notes, and labs. Oracle Health EHR can even facilitate conversational interactions to complex questions, such as drug interactions, dosages, symptoms, and diagnoses, informed by the latest clinical guidance and knowledge base. Oracle Health EHR is the future of healthcare, an immersive, AI-driven solution that not only equips clinicians with the intelligence they need, but gives them the time back in their day to focus on delivering the best patient care.
All right, here we are back at HIMSS with Oracle TV and more conversations on the transformation of healthcare. And I am here with my guest and my friend, Erin O'Halloran, who is the General Manager and Vice President of Oracle Health in Canada. Now, Erin, thank you first for being here with us. It's always great to
Thanks
talk
for
to you.
asking. I'm so excited.
Absolutely. You're leading the strategy and operations in the Canadian market. So to just jump right in, that is no small task, and especially at this pivotal time. So can you talk with me about the scope of your work?
Yeah, it's no small task. It's no small country. We're bigger geographically, but we got less people. But it's a big, hard job. But I am surrounded by brilliant people at Oracle Health. Our team is small but mighty. I have the privilege and the honor to lead a team that is executing the strategy of simplifying and strategizing around making healthcare a system solution, right? These are individual problems that healthcare institutions are facing, but it's a system. And so instead of just focusing on this problem, which we could solve,
Right.
it's the system, and how can we help our clinicians, our CFOs, our CEOs, the patients get the things that they need faster.
So you're thinking about all of those challenges
All the
at
things.
every level. So how is Oracle Health positioned to step in there and help solve these?
So that's why I came here. I just had my 2-year anniversary.
Congratulations.
I did. Yep. And so when someone has a solution to a problem, it's a really good thing. But when the problem is so massive and so fragmented and so systemic, you can't just have individual solutions. It has to be a system-wide answer. And so Oracle Health has a platform. It's not just a bunch of vendors or a bunch of solutions. It's a platform. It's a big solution to a very big problem, to unify all of the data that healthcare systems are dealing with.
And that is honestly what differentiates us. And we talk about it all the time. It's our unified platform. This is EHR, OCI, Fusion Applications, AI data platform. And why does this make a difference in your market?
There's not a data problem in healthcare. There's no shortage of data. CFO works with data, a CMIO works with data, a CEO works with data, but they're working with data from different systems. There's no shortage of data in healthcare. When it's not unified and it's not coming from the same system, they're solving individual problems, hard problems, but they're not looking at the same system.
Right.
So we are bringing that together. The quality of the data, there's a saying, the data has gravity. Oracle as a company was built as a data platform company. When you integrate an EHR and a back office ERP or human capital management system, you're all of a sudden looking ahead to solve the problems that you have today, but knowing what they're going to be tomorrow.
Right.
It's a strategy. It's not a fix. It's not a Band-Aid. It's preventative.
You're
like
looking down
healthcare.
the street.
Like healthcare.
Yes.
Right.
Absolutely. And so, why are the capabilities under the same portfolio important for healthcare organizations?
If you have cancer in a rural community or you have cancer in a downtown city, you still have cancer.
Right.
Cancer does not discriminate. Illness does not discriminate. Everybody deserves the best care where they are. The patients matter the most. They are the heartbeat of what we are trying to do here. Bringing together all of this data to inform better decisions so clinicians are less tired. Our healthcare system is one of the most complex, publicly funded healthcare systems in the world. Everybody's trying to do more with less. There's less money. How does a technology company save a healthcare system that's government funded money? You bring it together, you operations, clinical things, financial solutions. So we can do this
at every layer. And you just almost touched on something that I want to know. It's the public sector. Why is it so important there?
Anyone who's worked in the public sector for any amount of time knows that it's a mission. I have worked in and around the public sector my entire career. These are very, very real problems. People are getting older. People are getting sicker. Governments have less money. But The problems are still there. They're getting harder. It's coming faster. And it is really why I get out of bed every single morning.
That's your why.
Every single person has a healthcare story. Every single person has a healthcare journey, right?
I think that's so interesting. It's that, I've said it 1,000 times, maybe not that much, but enough that you've heard me say this too. It's like the one thing that unifies us is that we're all experiencing the same healthcare, that we're transforming. And it's because everyone has a story. It's your own. It's the person you care for, but you have a story and you can understand that at a very human level.
When you look at an X-ray, you look at an MRI, or you look at a lab, you don't know who that is, where they're from, how much money they have. They need to get better, and we have to help them.
And everyone deserves that kind of care.
Exactly.
Yeah, absolutely. So let's look down that street. So where do you see things changing in the next 3 and 5 years? What does success look like specifically for your market?
It's very, very exciting to me when we're sitting, at a conference like HIMSS with our partners, with our clients, some people who are not yet Oracle clients, some people who are, but are looking to, unify their data with other solutions. They're so excited. They're tired. They're tired. They've spent their whole career trying to fix these problems too, but they get it.
Yeah.
It's the first time in my career where clients get it. We almost don't even have to explain it to them, because they understand that when you go top to bottom, left to right, you have the breadth and depth of these solutions all built on a very secure, scalable cloud foundation.
Yes.
They almost look relieved. They're like, thank goodness you're here. Thank goodness you guys did this.
Yeah.
We need you so much.
Yeah.
So it's a lot of stuff to do and a lot of hard things to figure out, but they're leaning right in with us. And
I could actually feel you exhale when it's like just taking that deep, like, oh my, and the unified platform, it matters. And what I really appreciate, Erin, about you and your leadership, as we sit here and talk, not even talking about anything emotional, but still it's emotional and personal. And I can see that in you and how you talk about this work. So thank you for being that leader. It's important we have leaders who really understand the importance of healthcare and that every person deserves dignified care. So thank you so much for spending
You're
time.
very welcome.
Yes.
It's a privilege.
Absolutely. And thank you all for joining us for this conversation, and we'll be back for more.
We chose Oracle Fusion Cloud Application Suite to provide better access to information to make better decisions about what we're doing as an organization. The focus has been on more efficient supply management, more efficient ways of doing HR transactions, larger satisfaction with employee around less menial tasks, less busy work, taking that busy work off of our caregivers, off of our employees, and putting that into a centralized function where that's people's jobs. I mean, it gives more time for the caregivers to spend with patients. That's the ultimate goal.
Well, welcome back to Oracle TV. I am here with Dr. Bharat Sutariya, who is the SVP and Chief Health Officer for Oracle Health and Life Sciences. Bharat, thank you so much. I always enjoy sitting down with you and talking. I feel like I learn something every single time we have a conversation.
Well, it's my pleasure.
Well, let's dive right in because, year after year, we come back to HIMSS. We have the conversations. We've seen healthcare transform in the last 2 years and then move at lightning speed in this last year. So what are you noticing that's different this year?
Sure. As you mentioned, I've been coming here for many, many years. And what's different, even just in the last 3 years, is, a year ago, 2 years ago, AI was more of a pilot experimentation.
Yep.
And we have rapidly moved from a pilot and experimentation to AI truly being used inside the workflow to help reduce the clinical burden and showing success.
Yes.
And it's showing success across the board, and it's receiving a lot of positive feedback. So that's the big difference from a pilot to true enterprise usage and inside clinical workflow.
Absolutely. It's going beyond that hype moment that we all had and really seeing it into practice, which is exciting. So let's talk specifically, on Oracle Clinical AI Agent. So can you just share a little bit of what was this designed to solve?
Sure. So first of all, we consider clinical AI agents as an umbrella under which there are multitudes of agents that are clinically focused to helping the clinician. So of course,
an
umbrella.
Okay.
Of course, the first one being the ambient note agent, the ambient note agent, and what's interesting is that if you go across the HIMSS floor, there are dozens of companies that are doing ambient notes, to the point that I believe that ability to listen to an ambient conversation, convert it into a structured note, is now become commodity in the marketplace. Of course, we have our own note agent. It's live at hundreds of sites, very, very rapid adoption over the last year. But we look at the ambient AI note agent as a foundation to then build upon a bunch more workflow on top of it.
Got it. And this is in the documentation. It's in the workflow. So then what's next?
So what's next is, now imagine that a patient and a doctor is having a conversation, and you've got a system in real time listening, understanding, and orchestrating workflow. So that orchestration is quite important, because based on all of the things that say during the conversation, a prior authorization agent may wake up and say, oh, I heard physician talking about Mrs. Jones needing a knee replacement, and based on their insurance, a prior authorization is required. So on screen, in real time, a prior authorization agent wakes up.
Wow.
Physicians now talking about, oh, I'm going to renew your prescription. On screen, a prescription refill agent wakes up and guides the clinician, and so on and so forth, all the way from all the actions that are stated during the conversation. Not only captures the note in a highly structured way for a clinician, but it cues up all the actions that the clinicians need to take. And then either using a conversation by just saying, hey, I approve this, or by clicking on it, all those actions are completed. And that's why I consider the ambient note agent as just the foundation, but it's really the value that comes on top of it.
Oh, absolutely.
Where it automates the workflow.
Absolutely. I mean, queuing up the next step, it's helping to make informed decisions and move fast. I mean,
Yeah.
that's a big step forward. And I know that organizations are, they're implementing this in live environments. Are we seeing any early feedback? Are we seeing this work?
In my 25 years of being at the intersection of healthcare and technology,
Yeah.
this is the first time I'm seeing hype cycle meeting the reality,
Oh, that's
where we can deliver capabilities that clinicians really love using it, not just like, but love using it, and it's giving them a value. So we hear all the time now of the time saved. I don't have to go home and document the pajama time decrease. But more importantly, their experience is improved. Their focus on clinical care, that patient interaction, is significantly improved, because they feel less burden from an administrative task, and they feel like they have an assistant all the time present, helping them practice better medicine. So that's what
It's
gives
making them
me
better.
the chills when I listen to those kinds of things. As a clinician, it's such an important that we improve the lives of the clinician, because then the care they deliver to the patient improves.
Absolutely. It's giving the time back to the clinicians to take time with the patients. And I mean, I think that really speaks to why you're so passionate about this. And I love that you said the intersection of healthcare and technology. And I'm going to add, that this hype really is paying off, that maybe it's the intersection of healthcare, technology, and hope at this point, that healthcare is actually going to change. So then kind of taking a step next, we see organizations of all kinds, they want AI, but they struggle to operationalize it. What is it going to take for someone to move forward with AI?
It's interesting, and all you have to do is to walk the floor here. There are dozens and dozens of companies offering all kinds of AI widget today. And it becomes quite hard for an organization to figure out, what do I use for what purpose?
Right.
So my advice to, our customers, I'm out there every day speaking with the customers, is to say, start with the problem you're trying to solve and the outcomes you're trying to achieve.
Absolutely.
If you start there, then you'll be able to recruit the right process, people, and the technology to solve for that. And then you have a sustainable path ahead, and you're not going on a fractured path of bolting on, 20, 30 different things, right? So that's really the discussion with our customer base right now, is to let's make sure that we focus on the outcome we're trying to generate.
And that's actually what differentiates us. We're not bolting it on.
Right.
It's built in. And so, you know, go with me for a second on how the Oracle Clinical AI agent is going to evolve. What is it going to look like?
Sure. So I've kind of alluded to it already, right? That just the ambient note action is then queues up an entire orchestration layer that then brings in the order agent and the prescription agent and prior auth agent and so on. So we're talking about agents.
Yeah.
So we're talking about basically taking every workflow and agentifying it. But the end result we're trying to achieve is we're trying to cause a massive transformation. The industry has been at a system of record. So every EHR, every technology system that's been provided to date has been about system of record, creating a transactional system that serves as a source of truth from a record perspective. What we are transitioning to now is a system of intelligent care and orchestration, to the point that much of the administrative task is going to be done behind the scene, blinded to the clinician. Of course, they can get access to it if they want to review it, but on the administrative side, it'll be automated. The EHR interaction will feel much lighter to the provider, and it'll feel much more clinically intentful, so that they're focused on doing the right thing for the patient, right? So the end result is reduce the burden, have an ever-present AI assistant that understands who you are with your role as a clinician, the patient that you're trying to treat, the venue in which you're trying to treat patient in, whether it's ambulatory or acute. And with all of that context, as a clinician, you feel empowered to practice better medicine.
Is it fair to say that we really are in the era of intelligent care?
We are absolutely in the era of intelligent care.
Well,
and there's a much more to come.
Yes, I agree with that.
Yeah.
I mean, we are full steam ahead.
Yeah.
Thank you so much for spending time with us. It's always a pleasure to sit down with you.
My pleasure.
And come back and we are going to discuss a little bit more about this transformation in healthcare.
Before implementing the Oracle Health Foundation EHR, we had a few different siloed systems, but we were mostly on paper charts. When we went to Oracle Health EHR, it made a huge difference immediately for us. It's always comes back to the efficiency of the providers spending less time on admin and calling over to the different systems and trying to work between different systems. They have more time to spend with their patients and improve the care that they're giving.
Well, welcome back to Oracle TV at HIMSS 2026 in Las Vegas. We're going to jump into this next conversation that I am very excited about. I'm sitting next to Dr. Al Villarin, and he is the Chief Medical Information Officer with Nuvance Health. And I said that title correctly,
That's right?
right?
You did.
Okay, great.
Perfect, thank you.
Well, Dr. Villarin, can we just jump right into the ecosystem that you support? Can you talk about it, the community you serve? Give us a little glimpse into your life.
So we have 6 hospitals, 43 primary care clinical areas, and subspecialists throughout Western Connecticut, as well as Poughkeepsie region. We have 200 square miles of coverage and about 2 million patients that we cover, plus transfers in and out of our system. So we have a multicultural need to deliver understanding of the patients as well as the providers that deliver that care for our patients.
Absolutely. So then in your opinion, thinking about that, and I think just healthcare at large, what are some of the challenges that you face and then challenges in healthcare that could make the patient vulnerable?
Well, I think by design, we put the patient in a bad position, because if they don't speak our language, English, and if they don't understand what's going on with them, we have to translate 2 languages, the language of clinical care, so what's going on with them medically, but also in their comfortable language to build that trust with the patient. Most patients speak English, understand that when I describe a disease or a diagnosis with a patient, they get it. They understand it when we talk about it in a clinical sense. If they don't understand the language we're speaking, then that creates the barrier of misunderstanding, which leads to other negative outcomes later on.
And that makes a patient vulnerable. If they
Much
don't
very so.
understand the diagnosis, the treatment opportunities, it's that language barrier.
Right. And the language barrier prevents us from being efficient care delivery personnel. We tell them one thing and they come back to the emergency department just because they didn't know what medication they had to take, what diagnosis they had, who they had to follow up with, what the process was. And we designed healthcare unfairly for the patients who cannot speak English language.
Yes.
The LEP, as we call it, language, limited English proficiency patients, unfairly. Not by design, but like just an oversight. We have to correct that so we reduce the outcomes for those patients.
Well, thank you for bringing that conversation to light. And thank you for being an advocate for Oracle Health technologies. I mean, it's important how we're moving forward and what we can change in the area of language barrier. So let's talk specifically about OCI Language Services.
Okay.
What makes this the right technology for organizations?
When you design a technology like this that is ubiquitous in the cloud, you add the ability for all of the people responsible for patient care to access that information, whether it be in the emergency department, whether it be at discharge, whether it be on the ambulatory side. You're facilitating that unified care, that ecosystem of completeness that the patient will enjoy from the beginning when they first enter your health network until they're discharged and seeing their primary care physician. They know that we, as providers, care for them, not just clinically, but emotionally, because we're in contact with that emotion. And the language is an emotional factor of communication for everybody.
It absolutely is. But how does that maintain, medical context and accuracy across 30 plus languages when fitting into these high pressure work streams?
It's an automation. So what we're looking forward to is work with Oracle to build that automation wherever we interact with the patient. So the clinicians don't have to develop or click or create something. It's a known reason designed into the workflow that's automated so that clinicians and the patients, all of the end users, regardless of where they are, have an automation that prompts accurate delivery and understanding of the care you want to deliver.
So go a bit further, and what are you anticipating most with this technology when you think about the patient safety or the provider efficiency?
I think we have to do more for patient access to the information in their personal language.
Yes.
So that AI agents now can understand Villarin Spanish. I'm going to communicate through the chatbot to patient portal, lab tests in the native language. Every patient that comes to our organization that we register, we ask their preferred language. So that should transmit all of that information to the cloud. So anytime clinical information is interacted with a patient, it's in their native language. And that facilitates that glue, that trust that we're going to carry that patient experience in a positive manner, regardless of where we see them in the care journey.
So then building this foundation, it really becomes a thing that's going to change this barrier that stands between the patient and getting the high quality health outcomes they want.
We have done research on exactly that. We looked at patients that come back with heart failure, and it's almost 2-to-1 that the patients that do not have language translation come back twice as much as the patients that have English as their primary language. That's on us. We have to fix that so those patients can have the same care and the same outcomes as English-speaking patients. That's our responsibility. So we work with clinical companies and vendors like yourself to facilitate that better care that we can deliver for those patients.
Absolutely. So last question I want to ask you is actually just about where we're at, and that's HIMSS.
Yes.
And so being at HIMSS this year, what's your takeaway? What's different?
Well,
what are you leaving with?
I'm leaving with the understanding that AI is the focus, obviously, for most things, but companies like Oracle have started to really listen to clinicians.
Yeah.
And Oracle is going to grow and manifest in excellence through working with clinicians and working with patients to facilitate that growth and understanding. AI is a tool, but it's a very powerful tool to unite care and caring for patients' outcomes. And by facilitating that across the board, all the Oracle patients, all Oracle clinicians will be better manifested in the future with all.
Yes. Thank you so much. Thank you for being here and having this conversation. Every single person deserves dignified care, and that starts with the language. We appreciate you, and thank you for your time today.
My pleasure. Thank you very much.
Thank you all very much, and stay right here. We'll be back for more conversations.
The Amazon Web Services, was really becoming expensive. in terms of scaling up or serving our increased number of clients. After adopting Oracle Cloud Infrastructure, today we offer better service level agreements, cost efficiency to our clients, and higher regulatory compliance and quality solutions.
All right. Well, welcome back for our final interview. And I am so excited to be sitting next to someone who is not only a colleague, but a friend. Jason Rizzo, Group Vice President of Oracle Health and Life Sciences, specific to North America sales. Jason, thank you so much for being here today.
Of course. Thanks for having me, Shanna. We've done this once before. It's a pleasure to be back here with you.
It's always a pleasure to sit down with you, and I always feel like there's never enough time.
This is a true statement, but let's make some time now.
Okay, well, perfect. So, Jason, as you walk around HIMSS, I mean, you've been coming back for years, but what's fundamentally different this year? Like, how does this feel different than maybe even 12 years ago?
Yeah.
Or excuse me, 12 months ago, I should say.
Sure. And the change is rapid, and it's a fantastic way to embark on this conversation, right?
Yeah.
So last year specifically, people were looking for elements in their business where they can infuse change and innovation, and doing it in a singular way, right? So last year there was a lot of talk about ambient listening, ambient technology. How does that change care at the point of care, and how does it enable clinicians to actually be more in front and present with their patients? Right. And that AI was a singular effort last year. And now what we're starting to see is that cascade across opportunities throughout patient care, and then also in the life sciences space as well, in their drug development efforts and then post-marketing efforts. So it's a really dynamic place. The change specifically, when we think about things like security, people look at AI and they're saying, well, gosh, I was really concerned about cybersecurity in general, but now I'm looking at cybersecurity specifically to anybody that's going to enter or touch systems in any of our clinical applications across our ecosystem. So the bar has been raised. And the scale of which these companies want to do that is really phenomenal. So
yeah,
about that.
I completely agree with you. And I mean, even just 12 months to be able to see how AI in healthcare is at every single layer, changing every single part of the ecosystem. And that kind of leads me to my next question, because AI really was a hype for a while. We're all very excited,
Right.
very hyped up about it. But it's moved beyond that. It's moved beyond experimentation and really moving into starting to provide outcomes. Can you talk a little bit about that from your view, from your seat as a leader of Oracle Health and Life Sciences?
Yeah, of course. And it's fascinating. I don't want to date myself, but I'm old enough to remember the beginning of cloud.
Yes.
And that hype cycle there, right?
Yeah.
And in that time, people were saying, well, this is really a new form factor. How do I actually bring cloud technology into a historically on-prem ethos for my company, right?
Sure.
And now with AI, what a lot of individuals and organizations are saying is, look, I have a need, and I'm doing it either in a non-automated fashion now, or I'm doing it in a way that requires too much effort and too much time. How can I, last year's conversation, solve this one problem through automation, AI and agentic AI? Now what we're hearing is, how can I do it in an area where I can get a proven value statement and then scale that across my business? It's very, very different conversation than 12 months ago.
Yeah, gosh, that's crazy how fast we have pushed forward. I would say that, and maybe tell me if you agree with me, but not every organization is there yet, but they want to be. So what has to be true inside of an organization for an AI shift to take place?
Sure. Well, there are two parts to that exchange, right? There's the consumption layer in our customer base, right?
Yeah.
And then there's Oracle and our peer group, right? And what are we delivering to the marketplace? So on the customer side, you have a recipient of technology. And a couple of years ago, all of this AI was about development tools where you had to have coding language. But now with natural language processing, it can become ubiquitous across your business. So now what customers are asking is for concrete business problems, smart people that are curious to solve them, and not people that have years and years of coding experience.
Right.
So that one element is one single philosophical change that's immense. Now, on the Oracle side and our peer group, it's a combination of things, right? So first of all, you have to have first-rate AI and agents, right?
Yep.
You have to have the right data to apply those agents to, and then you have to have continuity between product, marketing, sales, and certainly customer success so that the holistic customer journey is effective at every junction.
Absolutely. Well, I want to jump now and talk specifically on life sciences. So let's make that leap. I want to talk about data. Where are health systems getting stuck in using data in a meaningful way?
Yeah, well, it's not just health systems, right? Life sciences companies and everybody really, even the payer community, are in this situation where we have a business problem we want to solve, but in order to solve that business problem, I need to have great data, right? It's the old adage we said years ago of garbage in, garbage out, right? And now, the last decade or so, we've had this fragmented, sets of data across our industry. And the whole concept is, how can we bring not all of it together, but how can we bring the right data together at the right moment with the right agents to solve discrete business problems?
Yeah. And I mean, putting that to use is a big leap forward.
Mm-hmm.
And so when we look at the Oracle Health for life sciences and health, the AI data platform, what is it going to make possible that we weren't able to unlock before?
Oh, so this is one of my favorite topics. So the life sciences AI data platform, if you think about it at its core structure, it's really a unified data estate, right?
Mm-hmm.
And so it's leveraging, of course, the vast amounts of healthcare data that we have through the interactions in the EHR with Cerner, right?
Right.
And so now taking that with augmented third-party data, whether that be omics data or any other type of data, and then placing that in an area where we can turn that on for life sciences companies. And turn it on doesn't just mean one thing. It means myriad things, from target validation all the way before clinical trials to the onset of clinical trials and trying to solve what we believe is really the world's largest problem in clinical trials right now, which is patient enrollment, right?
Yes,
Finding the right patients with equity in mind, and then being able to get them into the right clinical trial or the right drug at the point of care. And it's really a statement of, the old adage of right drug, right patient, right time, and maybe even right dose at this point.
Right.
So it's very, very different. And we're seeing areas that are really, really important to life sciences and the life sciences ecosystem, but they're not in just clinical trials. They're not just in post-market and market access or in brand in the areas around brand tracking. It's up and down the continuum where people feel like there are manual areas with better data and agentic applied. We can bring great things to life. And so we're super excited about it.
It's going to change research and accessibility.
It's going to change research, accessibility, but most importantly, it's going to change patient care.
Yes. I mean, and that it always comes back to the patient and that experience. And that gets me to my last question, Jason. You and I, we absolutely agree on one thing. And I think many people, if not every person, would agree on that this is so personal because it's something that we'll all experience. And, we'll all be a patient. We've all loved patients. But when you look at 3 to 5 years from now, why is this a passion project for you to be a part of?
Right. I love that question. And thank you for asking that, because it is personal. It's human in nature. And it's probably the most important missional thing we will do in our lives together, right? We're sitting here at HIMSS in Las Vegas, which couldn't be further from a patient care setting, but it is the reality of what we live with, right? I have a mother-in-law that has late-stage Parkinson's. My wife and I care for her. I'm a patient advocate for a son that's 15 years old that has Crohn's disease.
Yeah.
And I myself will be a patient at some point, right?
Absolutely.
And so if I'm allowed to choose what I can do in this world and what I want my career to be and where I want my impacts to be, this is absolutely the place, right? And being at Oracle, it's convergent in the sense that we're in a place that has this amazing data asset. We're in a place that has great technology and great people. And now we can apply it to the things that we care about the most and that are the most important to us in the world.
Absolutely. I think it comes down to, I mean, it's very human. It comes down to, we'll be patients. We love the people who are patients, and we're passionate about what this change is going to make, change at every layer of the ecosystem. Well, thank you so much, Jason, for joining us. It's always a pleasure to talk to you. Big fan of yours.
Of course.
And thank you for your leadership with Oracle Health and Life Sciences. We will be right back after this.
By leveraging Oracle Health Data Intelligence, I believe that patients are the true winners. They're able to, instead of being the couriers of their own health information, be able to be patients. They no longer have to take their test results from point A to point B. Instead, we're able to take that data and have that present to the primary care physician, so they can look at it, remember it, and now have that conversation with their patient in the most humane way possible.
Well, I can't believe our time together has already come to a close. We've had some incredible conversations today, all focused on one thing: how AI is changing everything and how it's changing everything in healthcare. We are at that moment where we are beyond the hype, and we are at the moment where it's being put into practice. You know, healthcare is so personal to all of us. You've heard me say this so many times a day, because it's the one thing that unifies us all. We will, in fact, all be patients. We will care for patients. We are and will be experiencing the same healthcare that we are transforming. So this moment is important, and you can feel it. This is no longer an abstract future conversation. It's right now. It's taking shape. Thank you for being a part of this conversation and looking into the possibility of what AI can unlock and how it is and will continue to transform healthcare. Thanks for watching Oracle TV. I'm Shanna Adamic, and I'll see you next time.